This biobank is the first large-scale biobank for human tissue specimens in Australia, using state-of-the-art robotic technology to allow us to handle large numbers of specimens. The biobank can hold upwards of 3 million specimens.
I'm very excited about the whole area of health and medical research, and whatever we can do to build an infrastructure to support our health and medical researchers, whether they be in the health system, universities or medical research institutes, then we're in the game to really drive that for New South Wales.
This biobank has got significant levels of automation. It's also got optimum freezer storage capacity at the right optimum temperature. People can have confidence in storing specimens in this biobank around their longevity, that they'll be able to recover them, and that when they go back to answer those important research questions, they can rely on the specimen integrity. I hope that this will be an attractive place for researchers to choose to bank their specimens, and I'm hopeful that we can create some great research partnerships to see this biobank fully utilised to its potential.
This biobank allows us to pre-collect samples for researchers ready to go, so that it can expedite the completion of research, because collecting samples for individual researchers can be a very long and tedious process. But because of the way we're set up and we're linked through New South Wales Health across the state and through all the pathology laboratories, we've got access to lots and lots of really valuable specimens for research that we can collect and make available to researchers very quickly.
The New South Wales Health State Biobank is really critical to the New South Wales health research agenda, and having it based here initially on the campus of RPA, which already has well-established partnerships with the universities, our medical research institutes and other organisations, industry partners, but most importantly with our other local health districts and our clinicians, is really critical. Together, we're really going to be able to maximise the utilisation of specimens within the biobank.
There's no question that medical research and investment in medical research are leading to better cancer outcomes, higher survival rates. There's over 1 million cancer patients now survived cancer, 1 million Australians living having survived a cancer diagnosis. And there's no question that medical research has played a very significant role in improving survival rates in cancer.
I think the biobank's a game changer for the SACs. We've got one of the largest studies in the country, the 45 and up study, and soon we'll have the largest collection of blood samples in the country as well. Connecting these two really important sources of information will allow researchers to answer new questions about the causes of disease and find new opportunities for interventions, so new clinical interventions and new processes to deal with some of the key challenges facing the country.
We were really honoured at New South Wales Health Pathology to be asked to establish this biobanking service. I also think it recognises our fantastic clinical and scientific staff. We're going to have great minds together collaborating in this fantastic facility where I'm sure it is an absolute pleasure to come to work, but also state-of-the-art technologies, the best ideas, great innovation. I think we are on the verge of having some great big medical breakthroughs in this, and that's great for the community.